Okay, welcome back, everybody. I apologize. People have been on hold forever. We had two very special guests today. The United States Interagency Council on Homelessness, of course, is headed up by Robert Marbut, who is here with us, giving us hope that really think the cavalry is underway. In Los Angeles, you can find help with homelessness at LAHSA, LAHSA.org. You like LAHSA? Wait, Leanne, I don't hear her. There you
hello?
are. Yeah.
I don't know. I just feel like without any laws to put any teeth into anything, I feel like millions of dollars are going to waste with LAHSA.
I understand, but again, let's stay positive the way he was. I think he's got a plan.
I'm feeling hopeful for what he's doing. LAHSA, not so much.
Okay. Also,
I feel
LA
like a waste
Homeless
of money.
Outreach portal available if you see someone. LA-hop.org.
Oh, I've tried that. Tried that with our Max.
I know.
Oh, we went out and talked to him 3 different, 4 different, 5 different times.
All right. Let me get to the call. People are on hold for eternity, and I apologize for that. So, Julie, here we go. Julie, what's going on?
Hi, Dr. True. How are you? I just want to tell you it's an honor to speak to you. I've watched you for years.
Thanks,
Celebrity Rehab was probably the one show that was the most raw, accurate portrayal to the public about the severe addiction crisis we have in this country, and I still wish it was on the air.
Well, thank you for that. But here we are. We can try to keep pushing the messages out through shows like this. What's on your mind? You've been waiting a long time, and I'm so sorry.
That's okay. Thank you. I was married, long-term marriage, to a severe gambling addict, severe, multi-million-dollar gambling addict who actually was a physician. And as he got older, it got worse. And I started to think, after really looking at a lot of, reading a lot, educating myself, going to therapy myself, that there's probably a lot of comorbid, severe mental health issues involved.
Correct.
And
there's
so I wanted to ask,
different kinds of different sort of flavors of gambling addiction, and some of them, yes, have very severe.
What do you mean by comorbid?
Coexistent, co-occurring. But with gambling, it's sort of causational in some cases. But go ahead, tell me your question.
And so my question is, what do you do if you're dealing with a lot of codependent family members on both sides that still are dealing with the fallout from this, are not getting help, and it's sort of like a parasite that's becoming bigger than just the one person who has the addiction.
Right, of course.
What advice would you give to a family in order to deal with it so it doesn't get passed on generation after generation, in addition to helping the addict himself, who really has been on and off, right. Inpatient rehab treatment, and now, unfortunately, not in a good place again.
Right. Is he doing anything else besides gambling? Is there drugs involved too?
I do know that he does take medications for a heart condition. I don't know firsthand, but there are a lot of other codependent family members that have access to not only medications, but prescribing him medications. And so I can't speak with specificity to it, but my guess is that he is taking medications. He's not a drinker at all. No alcohol involved, but certainly years of prescription medication.
Enablers, or really, like, if these are obviously physicians because they're prescribing, and there are lots of medication that can make gambling worse. For instance, sometimes gambling disorders can be associated with bipolar disorder, and somebody who's treating somebody who complains of depression with a gambling addiction can make them more manic and make their gambling worse. There are anti-Parkinsonian medication that can actually induce a gambling state. So there's a lot of complexity in gambling.
And the gambling, is it because of risk and just...
Well, gambling, again, has have different flavors. Some people like losing, believe it or not.
Really?
They gamble until they lose. They only feel alive unless they're losing. There is debting gambling. There's winning gambling, and there's sort of a sociopathy, criminal gambling.
What was the second one you said?
Debting. They just get they're compulsive debtors. Wow. Yeah, it's crazy. And so it has many of these different, and by mood disorders can factor into it. And so I really worry about anybody prescribing. And it's also very common for there to be addiction to substances alongside the gambling. And you, Julie, did exactly the right thing, which is you took care of yourself. And much like, they say you've got to put the mask over your own mouth before you help a child. If the oxygen drops out of the airplane, same is true with addictive diseases. You have to have somebody in your corner. This disease will suck you in every time. addictions of all type, behavioral or chemical addictions. So any family member who's not actively involved in a treatment process is a part of the problem. They can't help it. They're necessarily a part of the problem. So it is either going to Al-Anon or going to a therapist. By the sounds of what's going on here, a therapist would be the right sort of thing to do for everybody.
And Julie, I mean, seeing here that your husband, it's like millions of dollars in debt from his gambling.
This was multi-million dollars. His drug of choice was horse racing. He is also a master poker player. And so the dopamine rush, everything that Dr. Drew talks about from a neuropsychiatric point of view is all in play with addictive family members who are physicians as well. And it's a cocktail for crazy making. And it had been so for quite a number of years. I've gone to Gam-Anon. I sought help in many different psychological arenas. I have an amazing therapist in New York who actually deals very specifically with sociopathy, psychopathy.
Good.
I suspect that all of this is intertwined with this.
It sounds like
dangerous stuff.
Yeah, it sounds like.
I mean, just the fact that you've stuck around this long, I don't know that I would be a saint like you. That's hard.
But don't you get the feel that Julie is? She knows what she's dealing with, right?
Right, and she's seeking to help. Yeah,
she's contained. She's not sucked into it.
But I guarantee you a lot of women would not have stuck around for that. That's a lot of stuff going on. With money, I mean, when it deals with your money and losing your homes and losing your relationships with family, it's everything.
This was everything with him. I protected myself to some degree. However, I will just say this to the public because I know that you reach a lot of people, Dr. Drew, that your discussions about cluster B personality disorders and mood disorders and anger management and all of that, if anybody out there senses that there's anything that's going on that even hits a couple of the points that I made, then I feel like I've been helpful. But certainly in my family, I can tell you that it takes a village. And my main concern right now is it took me quite a long time to really identify what was going on here because most gambling addicts are typically of higher intelligence than the average person. A lot of them are very charismatic and come across, I call it wearing a mask of sanity.
Right.
They do it for quite a long time until,
That's
so
more
all of what you're talking about, I wish it...
Characterologically, as you say, cluster B, access to characterologically driven components of people that are predisposed to gambling addiction. But, like every addiction too, they won't get help until
because in their mind, they're smarter than everybody else. They don't need to. They've got it under control.
It's really tough to get people into gambling care. And we're not even talking about him. We're just talking about all the
addictive qualities.
Well, no, we're just talking about all the collateral damage and trying to help those people because he sounds like he'd be very, very tough to treat. Julie, I'm sorry you're dealing with all that, but I'm glad glad you're taking care of yourself.
Thank you so much, Dr. Drew. Thank you. Bye-bye.
All right. And her telling the story, again, will help other people who hear this
kind
of stuff.
Of course.
He's not the deading type. He's the thrill type. So there's different kinds of gambling addicts.
Millions of dollars. Ooh.
Yeah, and that's something. Catherine wants to talk about something. Catherine, what's going on?
Hi. Thank you for taking my call, Dr. Drew.
You bet.
I really want to thank you for all that you do for people. My question is we are having a numerous amount of unborn children being born to heroin, meth, etc. Is there anything that you can start doing to try to help us bring in some kind of law or act that would allow a loved one to have an adult addict committed if they're pregnant? To protect the unborn.
Some states, some states will do that. Some states, not with opiate so much. And by the way, an opiate addict should be put on methadone or Suboxone. Babies then are born dependent on opiates, and they have almost no withdrawal. People make way too much of that. The problem is taking heroin during your pregnancy makes the pregnancy end and gives pre-intrauterine growth retardation and preterm labor. Right. But if you get on a long-acting opiate or on Suboxone, you can have a full term. The baby will be born addicted, go through a little diarrhea, and that'll be that. It's no big deal. Meth is destructive.
Right.
Stimulants are destructive.
I have a
personal story. And in some states, let me just tell you, in some states, they will arrest the mother for child abuse.
Right.
For meth use.
That's what I
pregnancy.
think. Yeah.
So go ahead.
Well, I have a personal story that affected my grandson. My daughter was 23 years old, and we live in California. And I contacted Child Protective Services, asking them to arrest her for child endangerment because she was an adult. There was nothing I could do, even though Laura's law is a law in California. Right. It has to be enacted county by county.
I know.
So then 9 months later, after I'm told they won't help me, they take my grandson and lie to deny me placement of him. So it's another horrible thing because CPS is then removing these children and denying bio-family. It is a national crisis, Dr. Drew, and I want it to be heard. It needs to get out there. There needs to be one in every state where a loved, concerned grandmother or mother or whomever could get this person committed or ordered into rehab.
We have been begging for this.
She lived in Tent City. There was no way.
Catherine, we've been begging for this in California, literally going up with politicians and begging. You can be checking with John Morlock. He'll take you up to Sacramento with him. What are you going to say?
No. I mean, it just seems like, isn't that, you would think in the best outcome for the child would be to be placement with a loving family member who wants the child.
Yes.
I don't understand why that's a problem. I mean, do they think that you're too close to the problem of the daughter, the son, whoever's having the problem with the child in the first place, that the child might be exposed back to that person?
It may be more of a systems thing, like they have liability if they don't put them within the system. You know what I'm saying? Yeah, I know.
Yeah, but a kid is only going to do better if he has a family member that wants them.
I'm with you 100%.
Oh, boy.
Randy, sorry about all the delay. What's going on, Randy?
Hi, Dr. Drew, and it's a pleasure to be on. I've watched you for a while as well.
Thank you, buddy.
So I've been listening to your show, and unfortunately, a lot of my questions were answered.
Oh, good. That's not unfortunate. That's a good thing.
It's good.
But I say it in a pessimistic way because this is what's going on. I have a son that's severely addicted, and he's had, some traumatic things gone on in his life. We didn't know he was going down this road until he's really so severely caught up. We've been trying to get him treatment. He's been to treatment, but he is still, I don't know, he's just severely in a desperate need. I don't know what to do. I've talked to the crisis response teams, and they talk about the civil rights. They understand that he has a problem, but they said they can't touch him and take him anywhere because he hasn't committed a crime.
Right.
It's like we're sitting here watching this kid die. Can't do anything about it.
That's what you're doing, and that's the laws. You must be in California. You're in Ohio. Wow, they've got that same problem there. We thought it was just California.
Well, I'm from Ohio, but I'm in another state right now.
Okay.
And because that's where he is. He's in another state. He's not in Ohio.
He must be in California.
You're trying to find him, right? You're trying to get him off the street?
He's not on the street only because I am putting him in hotels. I'm putting him here. And just so he's not on the street. He doesn't have insurance.
What's his drug of choice?
Methamphetamine.
Oh, meth is rough, man.
Yeah.
Meth is rough. It distorts their thinking so much. He needs to go somewhere for a year at least, right? He needs to go have an extended stay. And I'm sure he's paranoid and suspicious of you and everybody else that he's normally close to.
But what do you do with somebody that doesn't have insurance, Drew?
Well,
how do we help those people?
There are county-funded beds. Where is he exactly? Do you know? Is he in California? Because I know the resources in California, but you got to check with local.
No, he's not in California. He's in Oklahoma.
Okay, so you got to look for local resources that are. Most treatment centers will have some kind of either independently funded or county funded operations.
At least some sort of help.
Hard to get them. It's hard to get them, but you have to check every day and you have to call and call and call. And whatever.
He's gone to the mental health. I don't mean to interrupt. He's gone to the mental health facility and said it was a crisis. Asked if he could be received, and they told him as an outpatient.
Right. Well, then
therefore
take that.
That doesn't work because he gets caught up in the meanwhile and won't go back.
I know. I understand. And How
long in outpatient? What do they give him? 24 hours, 72 hours, maybe?
No, in outpatient he'd get like a month.
Oh.
But it's 3 days a week or four.
It's not like he just has to come in and out of the hospital, and that's what he's saying. If he doesn't feel like it that day, he just never goes back.
Well, he won't if he's using. But it's so. This is the stuff that Leanne and I have been screaming about. That there's no laws.
I mean, to have a dad following him around to make sure that he gets him into a hotel room while he can't do anything for the addiction or get him into some kind of shit breaks my heart.
The other way to go about this.
Well, it's not even that, because I can't follow him around because, as Dr. Drew alluded to, the paranoia and all that, then, he will turn on me like I have caused or created. I don't know what's really going on in his mind.
I know.
But I mean, you're there and you've put him in hotel rooms, so he's not on the street. That's what I think most desperate parents want to do and try to do.
Is there a world that you can get him arrested for using meth and get a enlightened judge to mandate treatment? Can you find
in Oklahoma?
I don't know how I could.
I've done that a million times.
He doesn't do it around me. And we've had him EOD. We had him EOD 2 times in one weekend.
What does that mean?
They held him for 24 hours and let him go.
Yeah, I know.
They did a video conference with the doctors over at the mental health place, and they didn't accept them.
Now, you can't hold people against their will for doing drugs. That's the crazy thing about our society. So you'd have to.
It breaks my heart. I'm a combat veteran, seen much tragedy on the battlefield, and here I come back home and watching this slow process.
It's horrible. If you can get in and use, go to the local police, authorities and say, look, I've got an addicted son. What do you have? Can you arrest him? Can you mandate? I've done this kind of thing a bunch of times where people get, in various ways, police can really be a part of the solution. They don't want to put him in jail, and they don't want him to die. They want to help you. And if they can do it, or if they can have a judge that can mandate, send him away for a while for care. I've done that, and it has worked, but it's difficult to do. You have to really do some legwork. But you really got to start with law enforcement and see if they have any resources that they can help you with. Randy, I'm so sorry. It's a terribly frustrating problem, and I wish we had better laws to help people get better.
Yeah.
Brian, what's going on?
Brian? Hey, how you doing, Drew? You live,
man. What's up?
I talked to you about a month ago about my mom who was going through chemo, and I was asking you about chemo brain.
Yep.
And unfortunately, she passed a couple weeks ago, and we've gone through all that. But
sorry about that.
My question for you tonight, and it's kind of uncomfortable to talk about, but I was able to travel out and spend some time with her when she was in inpatient hospice.
Okay.
And the hospice nurses told me when I arrived there that she was under a special contact order where the nurses, CNAs, had to be gowned and gloved and all of that.
Right.
Because when they admitted her, they noticed some lesions on her vagina.
Mm-hmm.
And they suspected it was herpetic virus.
Mm-hmm.
And I was just wanting to know your thoughts on that. If I don't think my brother and I took good care of her, and I don't suspect any abuse or anything like that.
Oh, no.
But is it
how old was she when
possible that her suppressed immune system over all of her chemo treatments brought out the condition she may have been harboring over all the years?
Absolutely. How old was she?
78.
So a lot of people, particularly women, can harbor an infection, a herpetic infection, and never know they have it. And when the immune system gets suppressed like this, then that's when it comes out, and that's when it's infectious too. That's why they have to wear all the gowns and things
to protect themselves
and passing it to other people.
Sure.
So maybe it was some handle. You can get herpes viruses on your hands and things, and maybe something happened when she was sick in the hospital and got transmitted that way. I doubt it. It's very unlikely. The more likely thing is she had it forever, never knew it, and no big deal.
That's kind of what I figured. When I showed up, and I was supposed to go there and help her out after her infusion, and then the infusion was canceled. And when I showed up, she was in inpatient hospice. So I was a little bit off guard and shocked. And then that's the first thing they told me.
Yeah. It's just,
that took a little bit for me to digest. But then the more I think about it, it's probably more common than not, isn't it?
Oh, yeah. Most people that have it don't know they do. The society makes a huge deal out of this skin rash, but it's a non-thing for people that have it typically. So, all right. Don't worry about it.
Thanks so much, Drew.
Glad you called. Sorry about Mom, though. Yeah. Okay, I got to get quickly. John, you want to ask about the National Guard to assist with homeless issue. I have no objection to that, but it doesn't sound like that's going to happen. It sounds like Mr. Marbert has a more carrot-oriented
some kind of plan.
That's what Leanne wanted.
National Guard. I didn't object to it.
It's not going to happen.
I just want federal. I've never been one to say National Guard per se, but I just think something needs to happen where California is forced to do something.
We'll see if they don't accept the help of the executive branch of the government. That would be very interesting, and then you'd be thinking about that. I really have
typically National Guard are when they're used as a state thing. The governor has to say, I want the National Guard to come in, like with wildfires and stuff like that. So it's interesting.
Daniel, go ahead.
Hey, good evening. Thanks for taking my call. Love your show, all of it. And I wanted to ask, I saw you're turning the Masked Singer. You have a great voice. The baritone is very unique. Sounded great.
Thank you. Unique.
I was wondering, the show The Masked Singer borrows, it seems, imagery of like Illuminati and Freemasonry. And I'm wondering, do you think TV shows and the media borrow that imagery because it's edgy, or is there something more going on there?
Well, I joined the Illuminati and the Freemasons to be on that show. I had to be indoctrinated into both. No,
you're giving away your secrets, Drew.
No, they're just. I've been in those. That's right. I've been in those meetings where they come up with these logos and things, and believe me, there's a bunch of people sitting around a table going, "Oh, I like that.
Yeah.
Oh, I like this.
Look at that. Put that on here."
So that's all they do. Leanne, thank you for being with us today.
Yes, of course.
It really was fun. It's been. I miss you.
It's like getting the band back together.
I know. We spent just about our usual time frame here too. Isn't that crazy?
Yeah.
Next show live will be January 26th. When we do the live call-in show that we're doing. Be sure to sign up at drdrew.tv. You'll get a message when we're streaming. Also, we're going to do some daily doses, but we probably won't. I'm going to Sacramento to give a talk, as I was telling Leanne, so we probably won't do a daily dose until Wednesday or Thursday. Susan?
When you come back, yeah.
Which? Wednesday?
She just said
Wednesday?
Wednesday night, if you can. You don't know when you'll be back from your...
I'll be back Tuesday.
Taping.
That thing. Yeah, okay.
Am I allowed to say it?
I'm doing something for MTV.
Yeah. Can I tell them?
No.
It's pretty funny.
Off the air.
Yeah. Again, you can sign up with your email, but best option is sign up with your phone number because those alerts are quick and easy and no worries about spam because we are only alerting you to let you know when we are taking calls.
I did it.
And subscribe to the podcast at Ask Dr. Drew is now available as a podcast. So make sure you subscribe to all the podcasts, iTunes, Spotify, everywhere else, and go to drdrew.com. And I'm going to try to get some email stuff here. So do text your questions to 984-2-Dr. as well as drdrew.com/contact. We're going to get the emails there. And the links to me and Adam and After Dark and Dr. Drew podcast and all that stuff is there.
I want to do a podcast with you and Adam again. Like when I used to come on Loveline.
All right, bring you into there.
Nowadays, like with Adam, I would love to pick his brain.
You guys would find a lot of common ground, I suspect.
Oh, yeah. Well, and not only our racing stuff, but
he's got... Did you see this? You saw the Shelby documentary.
Oh, yeah, of course.
Yeah, and he's got a new one about a guy named...
the African-American driver?
Yes, called Uppity.
IndyCar driver?
Yes, he was a great driver. And
I haven't seen it yet.
He is one of the nicest men I've ever met. I'm blanking on his name. Willie T. Ribb. Willie. I just am excited for him that show gets out there because I think that one's going to resonate with people.
Yeah.
But yeah, I'll get you on Emma, Dr. Drew. We'll figure that out. Yeah, and for everybody else, we thank you for being here. Thank you for your calls, and we'll see you next time.